All right, let's go ahead and start. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, everyone. Good morning. Thank you so much for joining us today. You know, this is a very challenging situation, very challenging time that we all, stuck at home. A lot of us experienced a lot of changes in their normal routine and lifestyle and work situation. Some people lost their jobs. Some people facing financial crisis. Some people faces health crisis. A lot of change in our dynamic had impact our mental health, our emotions, how to handle them. By the time that the primary health care physicians in the front lines, the primary health care workers in the ICU and the emergency are facing and battling the coronavirus, we have our mental health experts, the psychologists and psychiatrists, are fighting on another front in this battle, trying to manage our emotions and how to remain in our well-being to face this problem. A lot of mental health problems can rise during this pandemic. A lot of problems can exacerbate and become even worse during this condition. So we are so glad to have our very own beloved brother, Dr. Muaid Ithman, from our community. He is an associate professor in psychiatry, and he is the director of the neuromodulation department, and I don't know what that is, at the University of Missouri. I will let him explain that to us. We are very honored to have such a talented professional in our community, and he will enlighten us about the anxiety during pandemics. If we open the topic for all mental health problems, it's going to take hours to talk about depression, OCD, and other issues, but we're going to focus today about anxiety mainly during pandemics. Dr. Muaid, this is your field. Go ahead and start. Jazakallah khair.
Assalamu alaikum wa rahmatullahi wa barakatuh. Actually, it's a great honor to be given this opportunity and to be among my beloved community members here. And I'm really thrilled to share some information with you and also listen to you and learn from you also if I have the time to do so. As you know, the whole world has been dealing with the first pandemic in the 21st century, and the last pandemic was in 1968. But since then, almost more than 50 years that we didn't have it. We have some epidemics or pseudo-pandemics, but this is the major pandemic that we have since then, and it has almost put the whole world into a standstill and caused a tremendous level of uncertainty and apprehension, leading to anxiety among all people, I can say, and about what the future will bring to them. So in this presentation, I would like to discuss a couple of things. I know the time limit and I don't want to go too deep into it, but I would like to discuss a little bit about anxiety, anxiety disorder, anxiety and COVID-19, dealing with anxiety during the current situation, what our religion teaches us about anxiety. And I give the disclaimer that I'm not qualified as a scholar, but I will have some information from some scientific literatures, and I think we have enough qualified people in our community and wonderful imams here that can really answer these better than me. And then if there's some time, I will, for questions and answers. And if you have any private questions, you can text. I think Dr. Mohammed can help with that also. So, as you know, our emotions are and mood are a very complex process. It's very difficult to understand that, but as much as we know, there are three factors that impact them. We call it in our language in psychiatry biopsychosocial, meaning that there's the biological factor that is the genetics. That's how our brain developed and our our family genetics, the illnesses that can impact them. There is the psychological factor, that means our personality, how we were raised, and there are the environmental factors, and meaning the work, finances, social, marital, and event that happen in the world. All these can impact our emotions and our mood. And we encompasses a wide range of emotions that can change depending on the situation and time. And we can go from a happy mood to a sad mood. If you hear a nice, good news, you're going to be happy on that day, or if somebody tells you something sad, you're going to be sad. You can be calm, and something happens, makes you anxious. So our mood and our emotion can change depending on the time and the situation. And anxiety is a part of our normal emotion. It's not something, it's not a disorder, and some people need that to keep them going and achieving some of their goals. However, too much anxiety can turn into a disabling disorder. So knowing, trying to understand that, we need to also understand a couple of things here, that we live in 3 domains. The main domain that we live in all the time is the present, and we have also the future and the past domain. The past we know, but it's the past, what we lived, and now we are in the present. Most of the people live in the present, they go in their life, and they have a routine for it. And, you wake up in the morning, you have your breakfast, you go to work, you come back, you eat your dinner, sit with your family. That's a very simple, I'm trying to simplify it. But on the other hand, we have also, sometimes we go into the other domains and come back from it. Like, let's say you have, you're anticipating something to happen, like buying a house, and you're worried about your finances. You're trying to figure out everything. You may pass to the future and worry about that and try to solve that the problem. And then, but only time you're back into the present time. And you're going with your life. Same thing, there's an anniversary coming that reminds you of the lost loved one. And that may make you sad. That's in the past. But again, you're coming back to the present. Your life is going forward. These are within the normal kind of living within these 3 domains. However, in certain situations and in certain people will keep going forward in one of these domains and stay there. So your mind will stay in the future domain, however, your body is in the present domain. And that is when anxiety can develop and becomes more disabling. That domain, which I call it the what if domain, that the future domain, what if this happens? What if I do this and it will not happen? And as you keep going there, your mind will start racing, your mind will start to worry, and you're going to forget about your daily life and becomes more disabling. And that is the domain where anxiety happens there. It's hard to, because of the time, to talk about the past, but we'll focus on the future domain, and we'll talk about, more as we're going forward in this presentation. So, as I said, there is normal anxiety and there's anxiety disorder. So, what is anxiety disorder? Anxiety disorder includes disorder that shares 2 main features: excessive fear, which is emotional response to real or perceived imminent threat, and meaning that a person will get scared from a perceived threat. And best example, like if somebody walking will see a snake and you're afraid of it, you're gonna be scared of that and run away. That's what we call the fight or flight response, meaning that you're gonna have your heart race, your panic, and run away. That's a normal response. And the other part of the anxiety disorder is the, we call it the anxiety part of it. And that is when there is the anticipation of a future threat. So the threat is not there, but you're anticipating something bad gonna happen. And in this way, you're always in a tense situation. You're waiting for something to happen. Your muscles get tense. You're vigilant. I mean, it's almost like you're asking some, a guard to hold up a gun and wait for a danger to come. And that guard will stay holding the gun in a very tense situation, very vigilant, but there's nothing happen. And hours pass, but he cannot let his guard down. And that is the way you can feel the muscles getting tense. He's vigilant, and fear builds up inside that person. And any sound might make him feel very tense and scared. And these 2 conditions overlap each other. And so you can be having anxiety at the same time, you could have the fear, and so it can happen together. So this is what is anxiety disorder. And of course, these symptoms can be persistent and disabling. So what is the difference between this and normal anxiety that we're having? Because we fear, we get apprehended. So how can we differentiate between these 2? So the normal anxiety in it, like let's say occasional worry about events. So as I give example about, you have an exam for, you know, and you're worried about that. That is only at the time of examination. You go to the exam is done, you're fine after that. However, in an anxiety disorder, like generalized anxiety disorder, you have a constant chronic worry that disturbs social and work life. You always worry about small things, big things, anything. My children going to go to school. What's going to happen to them? I'm going to go to work. Something going to happen at work. My husband went to work. I'm going to pay my finances. Your mind is always racing. And this is the main core feature of what one of the anxiety disorders, the generalized anxiety disorder. The other example is self-conscious in social situation. That's a normal anxiety. Like, you know, you're invited to a dinner, invited to a wedding, invited to a group of people. You're a little bit conscious about yourself. I need to dress well. People might look at me. If I need to be careful about what I'm going to talk about. And that is normal too for many people. However, in another, like in a disorder form, like when people having a social phobia, they avoid these situations because they're afraid they're going to be humiliated, and they will not go to these places. And that is the disorder. Again, I mean, like, you know, you have an interview for a job. You feel anxious. You're gonna, prior to, or you're gonna give a speech. Prior to that, you feel a little bit like, you know, your heart is racing. You're sweating there, but you will go to that interview or you will give the speech. However, in people with panic attacks, they will not be able to do that. They're going to be having the attack and they be unable or disabled to go into that meeting. Some people, like, you know, experience or witness a traumatic event. They might have difficulty falling asleep on that day or a few days, and after that they go forward with their lives. With people who have post-traumatic disorder, and they can have recurring nightmares or after traumatic event, and they are unable to function with that. And the other thing, like with realistic fear from threatening places or situation, I gave the example of the snake or scorpion or anything that makes some people afraid. But with people with phobias, they're afraid from things that really they don't pose danger, or they have little danger, and they will have panic attacks from it. So as you notice, there's a difference that the anxiety disorder is unrealistic fear. It is persistent, and it becomes disabling as it goes forward in patients' life there. So if we look into the statistics that was done by the National Institute of Mental Health in the United States, there's an estimate of 19% of United States adults who had anxiety disorder in the past year, any type, I mean, like, of anxiety. The prevalence of anxiety disorder among females is higher than males, 23% compared to 14%. And an estimated about 31% of US adults experience an anxiety disorder at some time in their lives. And 50% experience moderate to severe impairment in their lives from anxiety. What does all this mean? It means there is a good number or substantial number of United States adults suffering from anxiety in a given period of time in their lives. Now, there was a survey done by the American Psychiatric Association, which is the largest representatives for psychiatrists in the United States, trying to see the impact of COVID-19 pandemics on anxiety. And this was done in March 18th through 19th, and involved about more than 1,000 adults in the United States. And the findings were interesting. I mean, like, they found that there was about 36% reported that the COVID-19 impacted their life, their mental health seriously. 59% impacted their daily life seriously. 50% of the adults worried about running out of food, and 57% worried about finances. 68% worried about long-lasting impact on the economy. As you see, you know, even not the immediate threat of the COVID, but later on they're thinking what's going to happen. And 19% reported trouble sleeping, 8% consumed more alcohol and drug substances, and 12% increased fighting with partner and spouse, primarily because of being stuck at home together. Very interesting. And 24% trouble with concentration on other things because they were focused on pandemic. Now, both these statistics shows, as I said, the first statistics shows that there's really increased number of anxiety among adults without the pandemic, and these shows there's increased number of anxiety among across the board, even though this was done almost like, a month ago. So even I think it wasn't that much, it still did the news. So maybe if we do it now, it's going to be more. And we need to pay attention to the impact of this pandemic on our mental health as we go forward with our lives. Now, as I said, anxiety disorder encompasses many disorders, but because of time, I'm going to just focus on a couple of them. And I'll talk about generalized anxiety disorder very shortly, and also about panic disorder. Generalized anxiety disorder is mainly a disorder that's characterized by excessive worries and anxiety. That is for anything, small thing, big things, that lasts more than 6 months. So in order to diagnose a disorder, you need a specific period of time that the person has to suffer from. So you cannot say somebody for a week having generalized anxiety disorder or having anxiety disorder. So the DSM, which is the guidelines that we use for diagnosis, gives at least 6 months of the symptoms to happen before you can diagnose and generalized anxiety disorder. And that person with excessive anxiety disorder will suffer from the excessive anxiety and worry. So their mind is always worried and racing. As I said, they are in apprehension and vigilant all the time. They're forgetting about their body. They will feel increased muscle aches and soreness. They're focusing on concentration is not good because they are just focused on their worries there. They get very irritable because they're thinking about what's going to happen next and what's going to happen, and if this will not happen, what will happen next. When they go to bed, their mind starts to race more, so they have difficulty falling asleep, toss and turn at night, getting more restless. Next day they are fatigued and tired, and the cycle goes on, and that causes a lot of impairment in their daily functioning at work, relationship, and other aspects of their lives. So this is a simple example of generalized anxiety disorder, and definitely people who suffer from this will be the most impacted with the current pandemic that we're having. The other kind is also the panic disorder. Panic disorder is the one that responds to fear, and that's characterized by the fight and the flight. And mostly this is be characterized by autonomic response, which is the vascular response, or the heart rate will go up. It's almost like when you're scared and you run away, your heart rate will start to increase, your breathing will increase, and you start hyperventilating, you start sweating, your hands start shaking, you're feeling nauseated, you're feeling dizzy. And this can be by itself as a disorder, just panic attack, panic disorder, or it can come with other anxiety disorders and becomes what we call panic attacks. Again, this is also disabling, and patients reach a point that they cannot leave their houses or their places because of fear of having it in public, or fear of dying actually when they have it. We have seen some increase in this also during this period of time because of fear of having the illness, and it's mostly a panic attack rather than being a panic disorder. Now, as I said, these needs, in order to diagnose them, 6 months, and we have not been in 6 months during this period of time. So it's hard really to diagnose people who have not had this disorder before as generalized anxiety disorder or panic disorder. But still, some people will suffer from some sort of anxiety disorder that will not fit into this criteria. And this is what we call it the adjustment disorder. And in this, there is the development of emotional or behavioral symptoms in response to an identifiable stressors occurring within 3 months of the onset of the stressor. So there is a stressor happened, and then some people are difficult to adjust to it, and then they start having symptoms that could range from hopelessness, frequently crying, depressed mood. They are irritable. They have somatic symptoms, meaning they have physical symptoms like their heart is racing, they're having pain, aches, and depressed or anxiety or tension. And this could last for up to 6 months after the let's say the crisis will go away, and that's called an acute adjustment disorder, or can sometimes be chronic and last longer. And they don't fit the whole criteria for the other mental disorders. So, and usually they have only a few symptoms there, but still it could be impacting and disabling their lives. So, what is how COVID and anxiety impact each other? Now, reaction to stress is different from one person to another. It depends on our background and how the community that we live in. So, and there might be response. Some people respond strongly to the crisis than others, like older people, and basically because their life changed now and they are more possibly restricted in their home than others. People with chronic illnesses are more afraid that they're going to get the disease. Children and teens are more impacted, and you have to be careful about that and we pay more attention to them. Healthcare providers are in the front line. They are worried, about their own health when they're dealing, especially in the hotspot areas, and also they're worried about their, loved one. When they come home and a big change in their life there, and of course, people, as I mentioned before, underlying with mental illness, depression, anxiety, and those who have history of drug and alcohol use. So how does stress present itself there? Now, stress can present itself in different ways, like fear or worry about health of self and others. So many people are fearing, about their health or about their loved ones. I mean, especially if they have children or elderly people in their families. That can be presented with change in their sleep pattern or eating pattern. Difficulty like falling asleep or concentrating, worsening of their chronic health problems like blood pressure can be not well controlled as before. Their blood sugar cannot be well controlled, increase in aches and pains. And also there is, as you noticed in the past survey, there's increase in use of tobacco, alcohol, and other drugs among general population, and that could also happen there. So we need to keep close eye on this part also. Now, as I said, children and teens are more affected, and because they have their own anxiety and they bear their parents' anxiety. So we have to be very careful about that. And they react differently than adults. So the signs that you need to watch for your children and teens, the following things that can indicate they are going through certain, anxiety and or other disorders, like excessive crying or irritation in younger children, returning to behavior they have outgrown, like bedwetting or potty training they were done before and now they are not. Excessive worry and sadness, especially in teens, unhealthy sleep or eating habits like binge eating or sleeping for long hours or not sleeping at night at all. Irritability or acting out behaviors in teens, they are angrier than when they were not before. Poor attention, loss of interest, they don't want to get out of their rooms or interact with the family. Complaining of headaches or body pain or other nausea or abdominal pain. And there is increased risk of using substance and alcohol at this period of time. Be open with them and ask them, especially when you see a lot of evidence of sadness and depression about hopelessness or worthlessness. I mean, like there is increased risk of suicide or at least thinking about suicide. So it's not a, it's good to be open about these subjects and talk directly with them about it. So what to do when you're feeling like, about anxiety? As I said, the pandemic can affect the people in different ways. I can say there are 4 groups of people. People with the mental illness already, like they have generalized anxiety or panic disorder, so this could worsen their already underlying illness. People who have difficulty in adjusting into this illness or into this pandemic, and that can put them in the category of adjustment disorder. Other people having just increase in their normal anxiety, but they need to take action in order not to get worse or develop more disorder in the future. And people who could, not notice that, but go for, they might develop any other, illnesses like generalized anxiety or panic disorder, in the future. So there are preventive ways, and I think most of you have been doing it, but just as this is a reminder rather than, or a recommendation. So begin your day with the gratitude, and that is most important thing. Before your feet hit the floor in the morning, start your day feeling grateful to your Lord for starting your new day and having the bounties that you have. Start your day with a positive thing. And remember, the bounties that you've been bestowed upon. Make this a focus of yourself, and teach it to your children can have a significant impact on your emotional health. The stress of our current time can weigh us down, and if we start our day in a negative way, we will set the negative feeling pendulum into full swing. So start the day with a positive way. Start the day with being thankful that you're alive, thankful for what you have, and go from there. Organize and structure your life. Now, we are humans that we are used to routine, and with this pandemic, many things have been disrupted. So don't lose control of your life. Have a regular schedule and stick to it. Make sure that you have a family routine. Go outside. Most of the research show exercise improve mental health and physical health. 20 minutes in walking in a park can help. Yes, some people don't want to go out. You can go into your backyard, or if you go out, keep the distance and keep the recommendations by the health providers. But try to exercise and try to take care of your physical health. Keep your mental health also in a good way. Get enough sleep. That's the most important thing. Sleep is very important, and being at home, or changing your lifestyle does not mean that you change your sleep style also. Be active during daytime so you have enough sleep at night, and keep a routine for that. Eat healthy. Evidence shows that eating healthy keep your mental health and your physical health in a good shape. Avoiding high-fat diet and sugar and red meat are important in keeping your mental health and physical health, and increasing your vegetable and fruit and lean meat are important things there. Stay connected with family and others, and that is something I think everyone is doing it, and our community is doing it in a very wonderful way. So keep doing that, and that's important. Help others if you can. And this is important. I mean, one of the defense mechanisms there are different defense mechanisms that we use to counteract stressors, and there are only 4 defense mechanisms that's considered to be mature defense mechanism, and one of them is altruism, which is doing good things in order to deal with our own stressors, and helping others is one of these altruistic defense mechanism, like making a donation of money, supplies, or time to a cause you care about. If you are going to a grocery store, pick up some items for a high-risk neighbors or community member, and might not be able to leave their homes. If you do this, be especially mindful of practicing recommended hand hygiene that you take and when you go to stores. Also, try to take care of yourself by cutting back on amount of time and spend on social media and news. You need some time for yourself. I know everyone wants to know everything what's going around them, and that's very important. But we need also to make sure that we try to empty the brain from all the information that we're bombarded there. I mean, like, it's reached a point that there's no storage to put in. So you need to empty that storage. You need to have some time for relaxation and having the brain to settle down, just not to have all these information going in and overwhelming the brain. And then explore self-management strategies, meaning that when you feel that you're overwhelmed, try to have some ways to relax, deep breathing techniques, meditations, or, as I said before, going out and taking some exercising or walking there. These are all, I think, techniques that you have been doing it, and many people knows about it, but it's just a reminder for us. And also try to limit contact with people who seem to have difficulty talking about anything but COVID-19 and worst case scenarios. That's very important. As I said, we need to pay attention to our own health in order for us to keep going and keep helping ourselves and families and our communities. We need to take care of ourselves. I give the example of being an empty cup cannot help a thirsty person, and we need to be a full cup here. And if we keep going, I'm not saying to give up on those people, but also you have to set the limits and set the boundaries there. So, and try to help those people also, but without getting sucked in and being drained out at the same time. So how to support family and friends? I think this is very basic. You can check in with your loved ones often, virtual communication, and I think this is the era that we have it. So check on them continuously, make sure that they're not feeling lonely and isolated. And there are different ways: telephone, emails, mailing, letters, and other ways to do that. And alhamdulillah, everyone is doing it at this point. And then we have also how to ease children into anxiety about COVID-19. There's different ways to do that. And, you keep them informed and support them. One important thing is knowledge. Knowledge is power. And you have to, first of all, get the knowledge and provide it to your children. And you get the knowledge from the resources that is trusted, and inform them in about what's going on there. Establish a routine for them. Establishing a routine is important for the children. Now they're at home, they're doing school from home. They need to have a routine there. One way to do this is structuring your children's day as close as possible to what it was before COVID-19. Like wake up, get dressed, eat breakfast at the same time they did when they were going to school, go to a non-distracting area of your home to do their homework, give it breaks as they get at school every 30 to 40 minutes, have a lunchtime, and make sure you have lunch with them. Engage in self-care. As you're engaging in self-care, the same thing, have your children engage in self-care. Teach them about relaxation technique, exercising, eating healthy, and good sleep hygiene there. Stay connected. I mean, kids feel isolated and away from their own friends, so keep connected with them. Each family have their own way to do it, so have to set rules for that and keep connected with their neighbors, with their friends, with their community friends, so they will not feel isolated there. And the most important thing also is that Children with anxiety often perceive a threatening situation to be more of danger than they really are, and it takes longer for their body's stress response to turn off. So be assuring them that, uh, parents are important to reassure their children. They listen to their parents, and they feel protected by that, and tell them that, that yes, there is a lot to learn about COVID, but adults are taking care of it, and there's no need to worry much about that, and that all we need to do is to be together and stay focused and stay healthy there. This conversation takes them long ways there, and it will reduce anxiety, and by simply making the time to talk with them. So, as I said, I mean, like I'd like to touch base on our Islamic religion and teachings and anxiety. And I said I'm not a scholar in this area, and I don't have any degrees in it, but I will leave the major part to our imams. But these are from some literatures that were published in psychiatric journals that talks about the role of Islamic teaching and anxiety. So, we have two main sources that we take our guidance, the Quran and the Sunnah, and both of them are rich in information and guidance. And it really teaches a lot, and it has a lot of information that can help people during stressful situations. I'll give some examples for it. Islam promotes positive thought process to help individuals in both preventing and treating psychological stress. I mean, the most important verse, I'm not saying most important, but one of the beautiful verses, so verily with every difficulty there is relief, verily with every difficulty there is relief. That is very powerful verse there that gives hope for everyone that there is a relief when there is difficulty there. Islam inspires hope in those who lost hope in this life, reminding them with the countless mercy of God. And never give up hope of Allah's soothing mercy. Truly no one despairs Allah's soothing mercy except those who have no faith. So always remember that Allah's mercy is there, and keep faith in that. Islam means total submission to Allah and relying on Him and all our affairs. He is the one who do all things and run all our affairs. So and when you have decided, then rely upon Allah. Indeed, Allah loves who rely upon Him. So there are a lot of examples in Quran and in the Sunnah about that. One of the cognitive adapting techniques that can be used to relieve stress and help in anxiety as well as depression is to count how much God has blessed us and trying to focus on what we have and not on what we are deficient in. And that's a good cognitive remodification that it's used in cognitive behavioral therapy in the present time. And our beloved Prophet Muhammad ﷺ said, look at those who are less fortunate than yourself, not at those who are better off than yourself, so that you will not belittle the blessing that Allah has bestowed upon you. One other thing also, it teaches us to focus on the present, not on the past or the future. As I said, the two other domains, and put our energy on that in the present time and work hard on that, and forget about our worries, about regrets. And the Prophet ﷺ said, the strong believer is better than and more beloved to Allah than the weak believer, and both are good. Pay attention to that which could benefit you. Seek the help of Allah and do not feel incapacitated. And if anything befalls you, do not say, if only I had done such and such a thing would have happened. Say instead, it is the decree of Allah, and what He wills, He does. For saying, if only, opens the way of shaitan. So the what if is the major thing that we need to avoid and put our faith in Allah there. I think one of the things in psychology is the attachment theory, saying that when we are raised on a good attachment with our parents, we have both better coping skills, better personalities. So imagine when we have a good attachment to Allah, how in our faith, how we're going to be strong and how we're going to be deal with our stressors here. So Islam and mental health benefits, I mean, in general, so Islamic religion promotes healthy behaviors. It emphasizes on personal hygiene, injunction against alcohol and substance abuse, strong sense of community, and also recommendation to engage in daily reflective practices there. So like, 5-time prayers, and also you can make dua and supplication there. So, and research has found that religiosity is predictive of better family function and less depression. Observing daily prayers is associated with reduced depression. There was a research showing that prayer reduced post-operative complication of heart surgery, after heart surgery, open heart surgery. And Muslim prayers themselves can be considered as a form of meditation and remembrance while praying, and they feel extreme, we feel extreme connection with the controlling power of this world, and that we receive maximum support from him. So that's very important when you're feeling anxious and stressed, to restore to praying. Also, dua is one of the things that you can also help you to deal with the stress during this period of time. So when do you seek extra help? So if you say, I have done this and I'm not doing well, or what are the signs that you can see in yourself or other people or the loved one that you can say, no, I need to seek extra help? You have to remember that we are not superhumans, and we could, do what we're doing now, but still we could feel the need for extra help. So you need to seek extra help, meaning that you need to consult with your primary physician or seek mental health provider help when you cannot think about anything other than COVID-19 illness. It's occupying your brain, you're incapacitated with this crisis. Your anxiety interferes for your daily life. For example, you have a hard time going to work or being in public space, even when the risk is very low. You isolate yourself from others when it isn't necessary. You feel hopeless or angry about the situation. You experience physical symptoms like headaches or upset stomach. And finally, do not forget that everyone is going through this and we are all together in it. And the most important thing to remember that it shall pass. Jazakumullah khairan for giving me this opportunity and to talk. And I hope that everyone will stay calm and safe. And may Allah bless our community and keep their hearts all together.
Jazakumullah khair. Thank you so much, Dr. Muaid Ithman, for this beautiful presentation. I would like to remind the audience and the participants, there's a chance that you can chat and type your questions in the chat box. It is promoted to be just private, so only me and Dr. Ithman will be able to see the questions for your privacy. And also feel free to raise your hand so we can unmute you to ask a question as we go. I think one of the important things to mention here is that Islam was one of the first cultures or ideologies that recognize mental health problems as a problem that can be fixed as any health problem. So it's like a physical problem that should have treatment. So the stigma that we have in our Muslim community that those who have mental problem are maybe affected by jinn, or they cannot, they have this social stigma that prevent them from seeking help, or this misconception that if you seek help, it means you're gonna stick to a medication that you're gonna use over and over for the rest of your life. Can you emphasize slightly on this, Dr. Ithman? Is medication always your option to treat anxiety and other mental health problems?
No, medication is not the first line of the treatment for anxiety. As I mentioned before, we try to use the non-pharmacological techniques in treating anxiety. So we try to restore to, let's say, the teaching the patient relaxation technique, meditations, using exercise and these techniques, and also psychotherapy is one of the ways that treatment, of the treatments. You mentioned at the beginning neuromodulation, which is another technique of a treatment. There are some not non-pharmacological techniques that you use small devices that the patient can hook to their ears and use it. They are very safe and they can lower the anxiety. So the treatment, the medication are not the first line. But however, I mean, like you have to assess the degree of the disability that the illness is causing there. So we gauge that our treatment option on the degree of disability. If it's a mild case, we are not going to use medication. But if the illness is so disabling, we might need to use it for a period of time and then reassess again for the need of that medication. So it depends.
Perfect. During this pandemic, did the university, psychiatric clinic and the university, create any more accessible resources? If people have problem, whom should they contact? There is always a confusion whether my problem should be seen by a psychologist or psychiatrist or behavioral therapist. So what is your take-home advice here? Where should we contact?
I mean, the first thing I think I don't think there's an open, it is, the university has not developed like a crisis line, or at least our department, but our things are open. We're seeing patients through telehealth at this point. My advice will be at the beginning is to contact your primary doctors and the physician, because that is the way that most of the referral will happen there. And then after that, if they cannot handle it, they will refer them to us. And usually it goes through the psychiatrist, who will decide whether this will do the first evaluation and decide whether this case, as I said, will need psychotherapy or they will need medication, and then or both together. And then we will divert the case to the proper channel of the treatment.
Perfect. Would you mind, Dr. Ithman, to go back to the Islamic teaching with anxiety, the last two slides?
Sure.
So one of the things that you mentioned in these slides about the positivity in Islamic teaching, how Islam encourage thinking positively. So when you have a hardship, think about the ease that comes after this hardship. Allah subhanahu wa ta'ala is mentioned twice in this verse. Yes. It is really important here to mention, I'm not a scholar, and we're going to have our beloved senior scholar, Dr. Shakir Hamoudi, will elaborate a little bit about Islamic perspective here.
Yeah.
Just from personal intake here, I understand that our path to Allah subhanahu wa ta'ala is based on a tripod or triad of love, fear, and hope. So it is really important during this critical time to not focus on the fear. Sadly, you can watch many Muslim scholars emphasize that we are so bad. We made so much sins that Allah is so angry at us that He kicked us out from His houses. Even Kaaba has been locked down for the first time in history. And this just, I believe this will just emphasize the negative thinking in a way that may worsen the current mental health crisis. We need to combine the need for repentance and think about sins with the bigger picture of the mercy of Allah subhanahu wa ta'ala and His forgiveness. And as we are approaching the month of forgiveness, we always need to connect ourselves with Him, remembering His love to us. He bestowed His blessings and gratitude to us. We have the home that we are sheltered in. We have all these blessings that became part of common sense that we never thought about it. Think about the blessing of just being able to go to the grocery store to shop. Think about the blessing that you can get your kids in the bike in the backyard. These all of a sudden have been prevented, right? So it's a reminder that how many blessings that Allah bestowed upon us. The flexibility of closing the masajid remind us how great is this religion in a way that is teaching is so flexible to cooperate with all the health guidelines and all the up-to-date recommendations So there's a lot of positive there that we can think about and reflect upon, not only emphasizing on the negative thoughts. I will deliver from here to Dr. Shakir Hammoudi to elaborate more about this, and we'll come back and take your questions. I know Dr. Rashid Nizam is raising his hand. We'll come to you very shortly, Dr. Nizam. Let me just go to Dr. Shakir and make him as a co-host. Dr. Shakir, you can go ahead and open your screen, your video and your mic, and give us 5-10 minutes about the Islamic perspective in dealing with anxiety. Jazakallah khair.
جزاكم الله خير. السلام عليكم ورحمة الله. جزاك الله خير Dr. Ithman for this wonderful presentation. I think you covered both the professional and the Islamic. So I have a suggestion really, because this subject is so huge that I could designate next Friday for finishing the Islamic aspect of it.
That would be great.
Because 5 minutes and 10 minutes probably will take us to the full hour, and maybe the brothers have many questions. So this is a suggestion. Otherwise, I could talk for 5 minutes.
No, I will meet you in 5 minutes. No, don't worry. Yeah, 5 minutes. Yes. Okay.
Well, then I have to be very, very quick, and then probably I'll finish on Friday if I feel there is a need for more. Let me start from the last point that Dr. Muhammad Samrai Zallah Khair elaborated on, that in some areas that we start with the fear. In fact, it is a sign of the love of Allah subhanahu wa ta'ala to the believer that he puts him through the test. Why? Because he is giving him, while living, he is giving him another chance to straighten himself and to stick with the path of Allah subhanahu wa ta'ala. So this is, we have to, as Dr. Uthman said, we have to be positive. The Muslim always has to be gratitude toward Allah subhanahu wa ta'ala, thankful to Allah subhanahu wa ta'ala. وَإِذْ تَأَذَّنَ رَبُّكُمْ لَإِنْ شَكَرْتُمْ لَأَزِيدَنَّكُمْ. Allah subhanahu wa ta'ala has decreed that if you thank Allah subhanahu wa ta'ala for his bounties, he will increase you in his bounties. So, and we know that every bounty is from Allah subhanahu wa ta'ala. وَمَا بِكُم مِّن نِعْمَةٍ فَمِنَ اللَّهِ. And whatever bounties that you have is from Allah subhanahu wa ta'ala. So we have to be positive, and we have to understand the message of the ibtila, the sickness, or this pandemic as a love from Allah subhanahu wa ta'ala to the believers. It could be a punishment for others, but this is not our subject. The second point I would love to stress is that there is no animosity between Islam and science, or between Islam and medicine, or the many kinds of medicine, whether it is biological, whether it is psychiatrist, whether it's psychologist, whether even it is spiritual. All of them, the Prophet ﷺ says, ما أنزل الله من داء إلا أنزل معه الشفاء. Allah subhanahu wa ta'ala did not descend a sickness without sending the cure for it. And whatever comes is from Allah subhanahu wa ta'ala. Just like when Umar said, نَفِرُّ مِنْ قَدَرِ اللَّهِ إِلَىٰ قَدَرِ اللَّهِ. We run away from the decree of Allah subhanahu wa ta'ala to another decree of Allah subhanahu wa ta'ala. So we try to treat our sickness by the cure, by going to the doctor, by going to the hospital, and by taking the medicine if we need to. And the Prophet ﷺ taught us that neither the medicine nor the physician is the curer, is the one who cures. The curer is Allah subhanahu wa ta'ala. Well, who is the physician? What is the medicine? He said, these are only the asbab that Allah subhanahu wa ta'ala made them part of his qadr. And we have to remember that the first psychiatrist hospital was in Baghdad in 705. And the next was in Cairo in 800. And then next in Damascus in 1270. And then started in Europe, the first hospital for these sicknesses. The other point I want to emphasize that Islam, and it was very nice of Dr. Uthman when he put those 3 circles, if you remember, about the past, the present, and the future. Islam teaches us that the past, I have no more control over. The past is in the past. I have no control over. The future also, I have no control over. Yes, I can plan and I can be very precise, but at the end of the day, it is only with the tawfiq, with the blessing of Allah subhanahu wa ta'ala, with the qadr of Allah subhanahu wa ta'ala, that I can achieve the results. Then what do I am left with? I am left with the present, with my day. The question and the challenge for me is how to enjoy this day, enjoy my life, but at the same time invest in my hereafter by avoiding the sins against Allah subhanahu wa ta'ala and against his creations. So how do I use today to benefit from yesterday to perfect my future, my tomorrow? So these are a summary of those 3 circles when it comes to Islam.
Jazakallah khair. So there's a question, I think you may be able to answer it, or Dr. Uthman, feel free.
Sure.
So can a believer have anxiety? Does anxiety or mental health problems
absolutely
the belief and the iman?
Absolutely. Remember that when the Prophet ﷺ was in the cave with Abu Bakr in the day of Hijrah, so what Abu Bakr really experienced was anxiety.
Mm-hmm.
He looked up and he saw the feet of the disbelievers, and he said, Ya Rasulullah, Wallahi, لو نظروا إلى تحت أقدامهم لرأونا. Or the Prophet of Allah, by Allah, if they just looked at their feet, at their shoes, they would have seen us. So he told him, ما ظنك يا أبا بكر باثنين الله ثالثهما. O Abu Bakr, what do you think about 2? Allah is their 3rd. And that's when Allah subhanahu wa ta'ala says, إذ يقول لصاحبه لا تحزن إن الله معنا. When he told his companion, do not be sad, Allah is with us. So the believer, yes, goes through anxiety and goes through more than anxiety, because you have, as Dr. Uthman knows better than me, you have a psychological sickness, you have a biological sickness, you have a psychological sickness, but you have even worse than that, which is the mental sickness, the mental disease. This is worse than the psychological or psychiatric sickness. So all of this could be encountered by the believer or non-believer alike. But for a believer, we have a rich literature, a rich dimension about our Islam that could help and enhance the treatment of the professional. That's why. That's why. I mean, if you want to stop me, please.
Yeah, I'm gonna ask you permission to stop here.
Okay, inshallah, I'll stop. Inshallah, yeah.
Jazakallah khair. Thanks so much. We're gonna take Dr. Rashid Nizam. He is raising his hand for a while. Dr. Nizam, welcome.
Jazakallah khair. Assalamu alaikum. I don't want to charge the patience of the participants already more than 1 hour. Alhamdulillah, that was very good. Alhamdulillah, very nice. You covered some of my questions already, and Brother Shakir also. Yeah. And then, so I'm sure I saw you recorded it, right? So you can post it.
Yes. And so yeah, so the recording will be posted on Facebook, inshallah.
Inshallah. And
yeah, we're gonna post the recording on the Facebook. So
give us the link. Send us the link, inshallah. Yeah. And thank you. And then this time it was much easier to join in. Jazakallah khairan. And thank you so much, Brother Dr. Usman. It was very educational, very nice, mashallah. May Allah bless you, your family. Very nice.
Thank you. I appreciate that. Jazakallah khairan.
Regarding the recording, so if you guys follow our Facebook page, the Islamic Center of Central Missouri, ICCM on Facebook, you're gonna see all the recordings for the previous, lectures and presentations. Dr. Uthman, a question came, would you mind sharing the PDF of your presentation with the community? I mean, it's up to you. If you feel free, you can email it to me, I can send it. Otherwise, the recording will be available on Facebook. A question from my 7-year-old son, actually he's gonna be 8 next week. He is hovering down with his video screen. He is asking, how can coronavirus increase stress? He is so into the coronavirus mood now. He asks Siri, hey Siri, how many cases of coronavirus in Missouri today? So Can you answer
Yeah,
him for kids mental?
that's one of the things that when you're asking me about coronavirus, it means that you're thinking about coronavirus than anything else. So that is what we talked about is too much indulging into one thing and forgetting about other things that we have. So that's the way the stress increases when we're starting to just think about only one thing and not thinking about other things that we're having there. So yes, it is important. It is we are almost everyone is stressed. We have to remind ourselves about it, but we have other things in our life that we need to pay attention to it. And it increases stress in this way that the brain will start just focusing on one thing, forgetting about the other things. And in this way, all your brain chemicals can be, I'm talking from more in the biological aspect, can be increased. And as you go more and more, anxiety can kick in this way. So give a break from Siri a little bit.
Jazakallah khair. Not far away from anxiety, Dr. Ithman, you know, multiple mental health issues like obsessive compulsive disorders, OCD, especially those who have germophobia.
Yes.
Now, I mean, obviously, recommendation to keep washing your hands, be very mindful about cleaning the surfaces and grocery stores, always try to be clean. I think this will fuel the anxiety and the OCD symptoms of those patients. What advice do you have for the germophobes at this point?
I mean, I think this is one of the, again, there is the disorder people, and there is the normal people there. So for people with the disorder, they need to watch their symptoms. If it starts getting worse and they are becoming more like, let's say my symptoms are under control and I was doing okay. Now it's doing worse, I need to consult with my provider, because the time that they need to have more advice and maybe adjusting their medication or giving them a better coping skills, because this is the time that we need to advise people who are suffering from underlying mental illness. Like, you know, I have obsessive compulsive disorder for illnesses. Now, as I'm taking a certain medication, I'm under control, but this is a more stress and it's symptoms are getting worse now. I need to, call my provider as soon as possible, and so they can help me. So not to wait.
Perfect. I think we're waiting for more questions. I want to remind everyone that this talk will be followed, inshallah, by another nice event happening this coming Thursday. So next week we'll be busy. We'll be having 3 different events. On Tuesday at 8 p.m., we are going to have 2 clinical social workers and the clinical certified educational therapist who are going to teach us about parenting during pandemics, how to deal with our kids and their behavior changes during this critical situation. On Thursday, which is the 18th, I think, 16th, Thursday the 16th, we are going to have our sister Zainab talking about what can I do, your guide to stress relief during the pandemics. So it's going to be practicing mindfulness and some practical exercise, like mental and physical exercises to lower down our anxiety and stress. So that will be a kind of practical guide after this informative lecture, inshallah. Wait for the information to spread by the messages, email and website and Facebook and the WhatsApp groups as well. And finally, on Saturday, we are going to have Mr. Zahir Aristo, who is the president of the Legacy Online Islamic School. He's going to teach us some practical tips for successful homeschooling, since all of us have been finding ourselves to be teachers in addition to being parents. So all these challenges will be addressed, inshallah, in next coming events. And finally, reminding that today at 9 p.m. we have our very own Dr. Ahmed Muaid lecture about Islamic history. Let me just go ahead and see if there's anything else. So yeah, I mean, currently we are only having Facebook page that we are posting the recordings on. We are working on creating a YouTube channel, and once that's established, we're going to spread all the previous recordings on the YouTube channel as well, inshallah. But currently, the Facebook is our only platform that we are sharing, the recordings. I think even if you have no Facebook, if you get the link through WhatsApp, you should be able to watch it. But currently, this is our own, our only social media, platform. I know I have one of our international brothers who joined us today, Dr. Abdullah al-Mashadani from Iraq. He is also a psychiatry resident. I asked him if he is willing to give us a quick input from the Iraqi experience. He is welcome to join or refuse to join, as up to him. I'm not sure what the situation in Iraq now. Dr. Abdullah, can you hear me? Yeah, I think he's not ready to talk now. Anyways, I think, yeah, and tomorrow Sunday we have the Quran recitation at 10 a.m. with Sheikh Musbahu. So again, tonight at 9 we have Islamic history class, and tomorrow at 10 a.m. we have the Quran recitation class. And the rest of the programs will be posted regularly, inshallah. Stay tuned. If you are not already following the Islamic Center email newsletter, please do so. Go to the website and put your email. You're going to receive the notification on time. And if you have any questions regarding this lecture, feel free to send it to me or to the administration, and we can share them privately with Dr. Muaid Ithman, and we can reach up to you. Again, mental health problems are health problems. There is no shame of being sick, there is no shame of contracting coronavirus, or there's no shame of having diabetes. There is no shame of being anxious or having depression or having OCD. You just need to seek help to improve your symptoms and getting better, inshallah. We pray to Allah subhanahu wa ta'ala that we all get through this together, inshallah, and managing and remain sane and healthy physically and mentally, and protect us all with our families. Thank you so much for Dr. Muaid Ithman for the beautiful presentation and very informative lecture. Dr. Shakir for his inputs, and everyone for their beautiful questions. See you tonight, inshallah, and for the subsequent activities next week. Jazakumullah khair. Thank you so much. Assalamu alaikum wa rahmatullah.
Jazakumullah khair.
Barakallahu feekum.